Hi, Maria. Thank you so much for joining our coffee chat webinar. Cheers to you. It looks like you have your coffee with you.
Yes, I do. I
We're
have my
so,
nurse mug with me.
oh, perfect. That's awesome.
Yeah.
Right on theme.
Yes.
So we're so excited to have you here. Thank you so much for joining us.
Thank
So
you for inviting me.
of course, of course. No, it is our pleasure. So we might as well just jump right into it.
Okay.
Let's start off by, telling us a little bit about yourself. Where do you work and what's your favorite thing about working there? What do you
Mhm.
specialize in?
All right, perfect. So my name is Maria Huling. I'm a registered nurse since 2015. Right now I actually own my own company. I have a home health agency here in Palm Beach County. And what I do is I do multiple things. I'm an owner, a director of nursing, a registered nurse, patient care coordinator, human resources, all the above. And
Amazing.
yeah, and what I love about my job is that I love hearing all the stories and meeting my clients and trying to help them with the right path of what they need to live their best life, really. Helping them, helping families. It's a lot of coordinating education. And I just love seeing how people change or fix their lives and get better. And that's what I love most about it.
That's awesome. So it sounds like you wear a lot of hats with what you do.
I do, yes.
Very inspiring to many of us because we know that's probably not easy.
Yes. Yeah. I mean, definitely didn't happen right away. So there's a lot of things that came along the way. And, the path that I took and what I chose to do is this. And I've been doing it for the last 4 years, and I will continue doing it until I retire.
That is admirable. That's awesome that you're so passionate. And again, very inspiring for all of us. All right. So, what made you choose this nursing as a career? And how has your perception on nursing evolved over the years, in particular with what you do?
Well, I have a very interesting background. I started nursing school later on in my life. So I have a bachelor's in restaurant business management. And
Wow.
yeah, so I ended up going to nursing school around, I think it was like 2010 or so. And so basically, my journey, I became a nurse in 2015, got my first job working in a hospital, working on the med surg floor for about 3 years.
Wow.
Yeah, like many new nurses, I started at the hospital, and I did have a new grad contract. So, like most hospitals do, I signed a 3-year nursing contract with them, but it was the best decision that I made because it did expose me to a lot of things, a wide range of different situations and challenges that stayed with me forever. So
Amazing.
those skills and experiences that I learned during that time really shaped me for who I am today. And with that being said, I was ready for a new challenge. Um, I ended up getting a wound and ostomy certification. I
Oh,
spent
wow.
about 3 months studying that, which got me into the wound care field, which I worked at a clinic for about, it was short term because I ended up getting into home health soon after that. And then I fell in love with it. So,
Oh,
um,
amazing.
yeah, so I got into home health, started working at home with clients, and that kind of just like really made me feel so it was so rewarding to do that because I was able to spend so much time with the clients. But I wouldn't have been able to do that and get there without the experience that I had prior to that working in the hospitals. So
Great.
with as much experience that I got from doing that, I was able to provide my clients with the best care, the safest care with my experiences. And what, in terms of what has changed since I started, I guess the switch that I made from my, position of where I was at the hospital versus home health, that really changed my perspective of nursing, because it made me really appreciate, first of all, the nurses working in the hospitals, because I've been there, done that. And but being able to actually see how people are at home, because when you work in the hospital, you just see them as they are in their hospital setting, and typically they're not always very excited to be there, and they just want to go home and get out.
Right.
But when they're home, you kind of get a bigger perspective of what's going on with other things that may be going on in their life.
So
That,
interesting.
yeah, that gives you a different perspective of how you will probably need to proceed with the training and education for the patient, and how they'll be able to adapt to being at home. So that was really eye-opening to me, because when you're in the hospital setting, you only see that snapshot, but then when you visit somebody at home, it opens the big picture of what's really going on. So that gives me joy, makes me feel fulfilled, that I have encountered so many situations with people at home and their different family dynamics and everything like that, that I've gained the experience to be able to provide so much education and training just tailored to what they need based on their home situation. So it's great.
That's amazing. That, yeah, I was gonna say, so that sounds like that was your pivotal moment coming from wound care, jumping into home health and really seeing, behind the closed doors, the whole body perspective of what that person's going through as a patient.
Yeah. Yep. And it's a lot. They don't, you don't see it. You don't see that when they visit a clinic or go to a hospital, until you really see what the things they may be dealing with at home. So
Definitely. That plays a huge role, especially if they're out of their element, I could imagine.
mm-hmm. Yep.
Okay, so what advice do you have for new nurses entering the profession?
The advice that I could give with my experiences is to embrace every learning opportunity, always have an open mind and an open heart. Our field is extremely dynamic and always changing. So that also requires us to continue to learn and grow and adapt. So you just have to embrace your journey and take notes of what brings you joy, what brings you that genuine satisfaction every day, whether it's comforting the patient, solving medical puzzles and problems, or simply being there for somebody that just needs you. This will kind of guide you to find like that unique path in this diverse field of nursing, because this field is so diverse and there's so many opportunities that we will never know how many opportunities there are, because you'll be surprised that there can be something that will be available for you to do that you're just like, oh my God, I would love to do that. And so always keep your mind open, because like I said, there's just so many opportunities, and keep trusting yourself and follow what brings you that fulfillment. You'll kind of discover that on your own. And I would highly recommend, just from the experiences that I had as a new nurse when I was kind of working in the hospital setting, I was really kind of like in that bubble of hospital work and hospital field of like, almost like that was my only option, I guess. But if you involve yourself in the community and see all of the different things that people do and the different opportunities that are out there, it's super important for you to really be involved in the different things that people offer, like their seminars or networking meetings, things like that, that you will meet people who do certain things that you would think were not even an option to do as a nurse. So it's really great. just always prioritize patient safety, advocate, always be the advocate. That'll kind of take some time as you grow in the field and become more confident. But that's what the patients need you for. They need you to be their advocate. And then just look out for your mentors and colleagues that give you the support that you need. Teamwork is crucial in healthcare. You got to find your little niche of group of nurses and colleagues that you work really well together, and also adapt to those that you don't, and just make sure that at the end of the day you're there for the patient and to provide them safety and quality of care.
Yes, I love what you were saying there. The advocacy of being a nurse for your patients, and also, taking advantage of all of those resources is so important, because you never know until you try and go out in the community and see what options are out there. That is very, very true.
Mm-hmm. Absolutely.
Okay, so let's see. Regarding all of that, how would you maintain work-life balance in a demanding nursing career?
Yeah, that's always like the big question, right?
Definitely.
Yeah, so I would say, just make sure you set some clear boundaries for yourself, and, don't overcommit, because the facilities or wherever you work, there's always going to be a shortage of nurses, and they're always going to need more help. And it's okay to say no if there's somebody's asking you for extra shifts and you already feel burnt out and you feel bad and you want to help, but you really have to think about how it's going to affect you physically and mentally, and you need a break, and you have to take that break to give yourself that self-care. So whatever it is that you need to do to that kind of like keeps you in that Zen mode of, no stress, you need to keep that in your life. Don't let that go. Make time for it, whether it's exercise, crafty things, art, walks in the park, whatever it is. Don't forget to do that and make it a priority to keep yourself in that great state of mind. Because if you're not in that great state of mind, it's going to show towards your patients, and they're going to feel it and they're going to see it. And then they start to lose that trust and confidence in you as a nurse.
Definitely.
So you just have to make sure you do that. Time management is super important. Just try to, as a new nurse, time management is going to be very hard for you to get into a good groove of what works well for you, what works well for others might not work well for you. So you gotta, you could still seek out for advice of what to do, what's the easiest way, or what's the most time efficient way to do things. And you just have to figure out what works best for you. And just ask for help, seek any support from your colleagues, the ones that you trust, the ones that you know will give you the right answers, because there will be people out there that you will ask questions about and they will give you the wrong answer. It may be intentional and it may not be intentional, but you have to be careful,
Right, for sure.
who you're with and who you surround yourselves with, so that you can stay sane and provide the best care.
Definitely. And it's true, burnout is real. So it's very important to, take care of yourself so you can be the best for your patients, I could imagine.
Yes.
So that's great advice there. Thank you so much for sharing that.
You're welcome.
So, can you share some tips for effectively managing stress and avoiding burnout in particular?
Yeah, I can give you some examples of what I did. The beginning, when you start off and you're training and you're going through all that, it's going to be tough. There's no way of, nobody's going to tell you it's going to be butterflies and rainbows, because that's not the truth. But it's temporary and you're going to get through it. So you have to remember that you're going to go through a little bit of a stressful time in the beginning, but it'll pass, and you will learn to you'll have a groove of how you do things on a daily basis. But what I did was I do like exercise. Exercise is important. It relieves a lot of stress, and I would do kickboxing, and I got all of my stress and aggression out on those bags.
That
And
is
I
great.
had some of my nurse friends, I told them about it, and they joined me, and we did it for about a year and a half, and they loved it too. And you just got to find a good way to get that stress out. And just surround yourself around people who like to relieve the stress the same way you do, and try to stay away from too much alcohol. you know so exercise is the best, for me it was the best way to relieve the stress, and just surround yourself around people who agree with how to deal with stress.
I love that. That is so true. You do have to find that kind of thing that you're so passionate about to take your mind off of the everyday nursing things. That is so awesome. And I love that you have like a girl gang going to kickboxing.
Yes.
That's very inspiring. I love
Yes,
that.
and even 9 years later, we're still friends. So, you build these connections with these people, and when you all move on to find your own thing, you still remember those nurses who were with you during those times, and just remember to keep in touch with them and stay together.
Definitely. You definitely need a strong support system because nursing is a lifestyle.
It is, for sure.
Okay, so what are the most challenging aspects of being a nurse and how do you overcome them? If you could put your finger on it.
Yeah, so this is a very interesting question. Like I think I have a lot to say about this.
Go for it. That's what we're here
Yeah, yeah. So, I mean, there's certain situations that you'll encounter. You'll see other coworkers do things that you may know are not right, or they're not doing things the right way, such as like cutting corners or not using proper technique, things that they showed you how to do in nursing school. And you have to remember that wherever you work, whatever facility you've been working at, has their own policies and procedures that you have to make sure that you know where to find them and how to look for them and how to read them, because sometimes they're a little confusing too. But you'll see situations that doctors, PA, social workers, CNAs, things that they'll do that you don't feel is right. And you have to say something, because a lot of times in these facilities, they have like anonymous reporting, which is great, which you can report things to some anonymous system, whether it's writing or computer or whatever. Any like safety concerns that you have, like, medical errors or unethical behaviors. I could give you an example of a situation that I encountered. So I was a relief charge nurse after about a year and a half of working in the hospital system. And, you have a lot of responsibility as a charge nurse to not only advocate for your patients, but for your colleagues. And I had a nurse that came up to me and she said, I saw something happen that Dr. XYZ did, and I don't agree with it. It's a safety concern. And I said, we have to report it. And, sometimes you may be afraid or may not feel confident enough to think that, should I really get involved in this, or I don't want to cause any drama or whatever. But you also have to remember that the patient comes first, and your duty as a nurse is to keep them safe. So, whether you're in a leadership role or, working as a floor nurse, you have to make that decision to say something, because that's the only way that something can be resolved or be prevented if something else were to happen to the patient. So this was a situation that it was like a bloodborne type of I guess the doctor was inserting a chest tube and he cut his finger, and he didn't do anything else and continued to insert this chest tube into the patient with his own blood being exposed to the patient, and then the patient's blood being exposed to him. So, and he didn't, he just kept going and pretending like nothing happened. And the nurse is standing there like, really? Okay. So, it's for also the safety of the physician too. Like, even if he doesn't care, but I mean, you never know what could happen, right?
Mm-hmm.
So yeah, you just have to make sure that you stand up for your colleagues, stand up for yourself. And also the other thing that usually comes up in people's minds as a new nurse is, I don't want to lose my license, right? You just work so hard on your license, going through school, passing your NCLEX, and then you want to make sure you do everything right. And it should be that way. And you want to make sure you kind of keep that in your head forever until the end, because there's so many medical malpractice lawsuits that happen every day, and you have to make sure you cover yourself. You always have to document on things that, especially when you call a doctor, do they call you back? What happened? What did you do to try your best to do what you needed to do? Because those situations will happen. And as long as you document what you did, whatever may happen or whatever lawsuit may come across, because you'll never know what's going to happen 4 years later. As long as you do that, you did your part, everything will be okay.
Yes, definitely. Documentation is everything, especially with how busy you are throughout your day-to-day being a nurse.
You got to take that time. It doesn't matter how busy you are. If you have to do it at the end of your shift before you go home, just remember, don't slack on that, because it's super important.
Yeah, you have to do your due diligence, that's for sure.
Yeah.
So as a spin-off to that question, how do you handle difficult patients or situations in your day-to-day work? So I guess that would be considered a difficult situation, but how about what if the patients are difficult? How would you handle that?
Well, you're going to get a lot of difficult patients. So, I think that communication is super important. A lot of times patients are difficult because they're scared. They don't know what's going on. They're afraid. They want to go home. They don't want to do what they're supposed to do. And there can be a lot of frustration involved with when you're trying to provide care for the patient and want to make sure that they're doing what they need to do too as a patient, because they have responsibilities that they need to do for their own health. But you just can't come across too stern. Communication is super important. You have to remember customer service is important too. If anybody has any experience in the hospitality field or worked in restaurants or did anything like that, that is a super plus, because it'll make things so much easier for you. Because you have to remember that wherever you work, it's also a business. Mm-hmm. So we're in this field to provide the best care and the best things we need to do for our patients. But at the end of the day, the hospital or the facility or wherever you work is also a business. So they want to make their clients and patients happy too. So you want to build that trust with them. You want them to, respect you as a person too. And sometimes that may be difficult, but you got to keep yourself composed and, give them, you got to listen to what they're asking you. So that's one of the biggest things that I noticed when I was working in the hospital and what I carried with me throughout my career. Mm-hmm. You really have to listen to what they're telling you, because sometimes they'll tell you stuff and you may think they're telling you something different, but you have to make sure you listen to what they're telling you and kind of try to resolve whatever it is that they're dealing with during that time that you're there with them. Because the most frustrated thing that people get mostly upset about is that they feel like nobody's listening to them.
That is a really good point, especially in times of stress, like you were saying, fear, pain, the least thing that someone wants is for someone to at least listen. That
Hmm.
is so powerful, and that will only make things be more efficient when you're giving
Yeah.
patients exactly what they need.
Yeah, and don't share your stressors or problems at home with your patients. I mean, I see that happen, and I mean, even in my field, I deal a lot with caregivers, nurses, physical therapists. I manage all of them, and a lot of times, what I hear from some of my clients is, "Oh, they're not giving me the attention that I need because they're going through this, this, and this," and then they start adding judgment to that, and
Right.
making up stories in their heads about why you said this and that. And it's just much better to just leave your personal problems at home and don't discuss them with the patients, because they have their own problems that they're dealing with.
Definitely, for sure. Are there any other essential skills outside of, clinical knowledge that you would add to what you're saying?
Yeah, I mean, like I said, customer service and communication, that is a big plus. I mean, it's kind of shocking to me, honestly, working in the medical field, working in different places, that, not a lot of people know how to deal with customer service. So whether it's something that is taught at school or something that you want to grow as a personal enhancement for you to be successful, I would definitely kind of do some research of, like, how do you word things when you answer questions, because the way that you say things makes a big difference when how the way the person reacts. So you have to go through there's very basic things that you could say, like if you don't know something or don't know how to do something, and you just say, "I'm sorry, I don't know the answers to that, but I'll find out." And you have to follow through. And
Hmm.
then that way you don't show that that you're not confident about what you're doing, because then if you say something else like, "I don't know how to do that," or "I don't know what that means," they'll be like, "Well, who are you? What are you doing here?" And then they lose trust in you. So usually the best way to answer something that you don't know is just to say, "I don't know the answer to that, but I'll find out." And then make sure you follow through and tell them what they asked for. um, and then I think that's actually probably one of the biggest things.
I would say so. From what I'm hearing, definitely.
Yeah.
Yeah, the comfort of the patient, I mean, is number one. And like you're saying, I think it's better to respond in that way and follow through with it than saying nothing at all or something that will kind of make them question you and your skills,
Hmm.
especially when, the stakes are high or the pressure is there.
Yeah, and especially when you're a new nurse, you're not going to know everything. I mean, you're
Right.
you're going to know what you know, but you might feel under pressure and not forget something. So just you know, don't don't think that you have to do something that you're not 100% sure about. You really have to know whatever it is that you need to do. If you need that support, you have to get it.
Definitely. It's better to, find out and learn how to do it the correct way than guessing
Yes,
your way through it.
absolutely.
All right. So, next question. Can you provide insight into the different career paths available with nursing and what
Yeah.
factors should students consider when choosing their specialty? Because I know you mentioned there's many, many specialties that they may
Yes.
fall upon.
Yes, there are a lot. So if you do end up working in the hospital, there's going to be a lot of different positions available in the hospital. So you have the surgical, you have med surg, you have telemetry, you may have ortho, you may have the ICU, CEU, or not CEU, ICU, the pre-op. There's just so many things within the hospital. Then you can go into a management position too.
Right.
Uh, so if that's what you like to do, that would be a good path to go and try to get yourself in some type of managerial role. But outside of the hospital system, I mean, there's so many different things. Like There's advocates. You can be a nurse advocate for somebody as a private advocate for them. Especially within the senior community, there are companies that hire nurses to be an advocate for the patient. So meaning that you can guide them in the right direction, help them go to doctor's appointments with them, relay information to family members that are not with them and want to know what's going on. As an educated nurse, people find a lot of value in that. There's in Florida, it's a huge elder community, so there's tons of opportunity within elder care. Like I do a lot of elder care with the home health aid services that we offer. We hire a lot of HHAs and CNAs, and as a nurse, you're their supervisor. They come to you you need to be there for their support and education and training. And there's positions like education and training within hospital systems too. So, there's obviously travel nursing and, assisted living facilities, long-term care facilities, rehab, nurse law. There's so many different aspects. And if you're an outgoing person, you may go into sales as a nurse because you have that knowledge and are able to become a sales rep for something that may be available, I don't know, a pharmaceutical or a company or a doctor's office or, stuff like that. So.
Yeah, that's really, really cool. And I imagine it's never too late, kind of like what you were saying in the beginning, to find your niche in nursing, and let alone, to go along with your personality type. I feel like that's very important as well.
Yes, absolutely. Yeah, because there's people who are not outgoing and want nothing to do with it, and they can work in the OR and then be happy about that,
Right. Yeah, it's good to find what works best for you, because that's what, allows you to live a fulfilling nursing career / life. Very, very important.
Yep.
So, how do you stay updated on advancements and changes in the field of nursing in particular?
Well, what I actually recently got into, which I knew about it when I was in school and when I started my career as a nurse, but I never really took it seriously. But there's the American Nursing Association, the Florida Nursing Association. I remember that when I was in nursing school, I think they had automatically joined us in this organization, and I never really looked into it. But as I started, getting more experience in my career, there's a lot of stuff that is involved with nursing laws and litigation, and so they talk about a lot of that issues that are going on in nursing. They speak on behalf of us in Tallahassee for any laws and changes that need to be made for nurses. And it's very interesting to learn some of the things that they talk about, and they want you as a nurse to give your input into what ideas you may have where changes need to be made. So, you're a good asset to that as a nurse with your experiences that you have, to provide some insight of how things can be changed to make it better for us. So, that's what I have gotten into recently, which has really opened my eyes of different issues and things going on in our nursing community. And yeah, usually when you're in the hospital system or wherever you're at, they usually have continuing education for you, and they'll keep up to date on the new things and the new policies and continuing education. But there's the option of being an independent contractor as a nurse, and you have to manage those things on your own. So, right. You got to keep up with your continuing education and your license, and there's, everything can be done online now. They have really fun ways to do it. They got these cruise ship events like NurseCon.
Wow.
Yeah. So now it's a big thing, and you can book this cruise thing that they have for just nurses, and you go on this cruise ship and you get CEUs and have fun with your nurses.
Sign me up. I'm not even a nurse.
Yeah,
Sounds
and
great.
it's crazy. It's like now they, you got to make it fun because they realize like how much pressure we have, how much stress we have, and we need to have fun and relax. And why not go have fun and get some CEUs at the same time?
Definitely well deserved. My
Yeah.
goodness. So, can you share a memorable experience from your nursing career that has had a significant impact on you?
Yes. So I guess it would be an obvious answer for me, but I had to think about it for a minute. So opening my company is probably the most memorable experience. You know, I do have that entrepreneurial side of me, and I always wanted to have my own company, and it was a challenge trying to find out like what could I do that I can do as a nurse, and have and own a company that's not going to cost me millions of dollars. So I really did a lot of research, and I did love home health. And in the home health industry, you can own a home health agency without having a physician on staff on salary, as an employee or as or medical, what do they call it? Medical executive or something. But that that happened 4 years ago, and I had to figure everything out on my own of how to do everything.
Wow.
So, I think that's probably my proudest moment, not only just having my nursing knowledge, but having that entrepreneurship mindset that, starting up this home healthcare company, there's a lot of things involved with rules and regulations and things you have to do to even get licensed to do this. So,
Definitely.
and I had no experience doing that. I never worked in administration. I only worked as a nurse.
Mhm.
So that's a challenge that I decided to take on. And I figured it out and worked my way through it. And here I am 4 years later, always having that same mindset of providing the best care for my clients. So right now, I probably have about 15 administrative staff and
Wow.
about 60 caregivers. And
That's amazing.
I have one full-time nurse and a physical therapist. And then I also use like some staffing assistants for some physical therapy because they're very hard to find, by the way, to work for you. But yeah, just going through that and still being able to be an advocate for my patients and knowing that I'm providing them the best that I can. That's the most rewarding thing I could ask for.
That is amazing. And that really does take bravery to take that leap and kind of pivot your nursing career. I mean, still along the same lines of what you're so passionate about, but taking it to that next level. That's
Right.
super inspirational to many of our students you're an example of what is possible. That is
Right.
very, very awesome.
Yep. Tons of possibilities.
Yes, very, very true. Okay, so what are some common misconceptions about nursing that you'd like to debunk, kind of segueing from that last question?
Well, I would have to say that, working as when I finished nursing school, I worked straight into the hospital. And like I said, it was pretty challenging just to kind of learn everything and get through things. A lot of times they don't really give you as much time as you need for training, and that is something that I kind of realized when I was there. But you have to make sure that you kind of stand up for yourself, and if you're not ready for something, you just have to keep the training going, because they just like a business, they don't want to spend too much money on you, training you for too long, and they want to get you on the floor.
Mhm.
So that's something that I experienced. The patient load was a little overwhelming, I would have to say, especially on the med surg floor. I think that was probably the most frustrating thing for me that I dealt with working in the hospital, because it was very overwhelming. And as a new nurse, it was even more overwhelming. And then as an experienced nurse, I would say, if you could say experienced after 2 years, it was still overwhelming. So, you know, you just really have to work together with your team to kind of get through those moments
Right.
of the high load of patients and working together. I did build a good relationship with my nurses and we helped each other out, because there's going to be times that you are you have a lot of patients and you're falling behind, and maybe your colleague does not have as many patients and they're able to help you, and you just
Hmm.
got to make sure that you seek out for that and help them get you out of the hole if you're in a hole. I did end up spending a lot of time after my shift charting,
Hmm.
especially in the beginning. And that was normal because I was learning the system. You do have to learn how to use the system, you have to learn how to navigate through it. And then once you become familiar with it, you become more efficient with it. And um, charting throughout your shift is the best advice I can give you.
Hmm.
When I first started, I had nurses that would tell me, "Oh, I do everything I need to do, and then I chart at the end of the day." And then you're left with 1 hour of sitting there charting all your stuff. So the best way to get out of there on time and have a sane shift is to take the time to make sure you document throughout the day and not wait till the end.
Definitely. And practice makes perfect. You can't
Mm-hmm.
expect to get things right the first time.
Right.
And as for, working under pressure, having to, work as a team, how would you say you effectively communicate and collaborate with other healthcare professionals within the team?
Um, well, I wasn't afraid to ask for help. So,
Great. That's the best
yes,
advice.
that is the best advice. And don't feel timid because, you're going to have some nurses who are understanding and have been through this, because everybody has to go through it, right? So, nobody goes in there as a new grad knowing everything what to do and how to do it. So, there's going to be people that you meet, that you work with, that have that understanding of where you're at with your the time that you've spent in the hospital, and they'll help you, and you just have to ask them and help each other out. So if they are there to help you, and if they can help you, make sure you return that favor of the help and help them as well, so that you guys can have like a good teamwork and build that teamwork. And as you grow within the time that you're in that facility, that you build that trust with each other. And there may be some things that you eventually will have more experience with, and that person will ask you for help, and they'll know that they can trust to ask you for some help or guidance on that.
Definitely. That is awesome. Especially with, working as a team and having so much time together. It's kind of like, uncomfortable conversation will happen and you just have to
Mm-hmm.
cross that bridge because that's,
Yeah,
for the best of the system and the patient's well-being.
absolutely.
Definitely. So, are there any other pieces of advice that you would offer on how to handle ethical dilemmas or other challenging patient situations?
um, I would say with the ethical situations, just follow your gut and know what it is that you feel is right or wrong. Um, I remember when I was in nursing school that a nurse always told me, always follow your gut. And I'll never forget that she said that, because the times that I don't follow my gut is the times when I should have followed it. So
Mm,
every time now, if you have that feeling of something's not right, or you see something that's not right, or you may think that something's not right, it's always better to be safe than sorry,
definitely.
especially when dealing with people's health.
Definitely. You got to go back to the basics. The very basics.
Absolutely.
As simple as that sometimes.
Yep.
So, what do you have any other resources or organizations that you'd recommend for students who want to kind of further their education or, pursue any specialty certificates or certifications?
Well, I mean, the experience that I had is the wound and ostomy certification. It was like a 3-month course that I had to do. It was all online, but you also have to do like, I think 40 hours of clinical um, when you follow a nurse and what is it in clinical experience. But there's other certifications that you can get. I mean, um, I'm not too familiar with much of them now because I'm kind of stuck in my industry of where I am. But, you know, the other great way to meet people or to get involved is to volunteer also within the community. Um, the American Red Cross is something that I actually recently got involved with because it is a volunteer organization that you can do as a registered nurse, and there really aren't too many of those available out there. There are some clinics that do that provide services for people who can't afford it, and they're always looking for volunteers as well. That's a great way to kind of give back and get that satisfaction if maybe you're stuck in a place that you don't love and need to get some of that satisfaction. Volunteering will give that to you. So there's a lot of well, at least that I know down here in Boca Raton or Boynton Beach area, there's a lot of events where speakers go and talk about different things, such as like elder law or different physician services that are available. There's a lot of mobile physician services out there now, a lot of stuff within the elder community because it continues to grow and there's different services that are being provided to them. So just having that knowledge, because also as a nurse, if you can provide the patient with some information that will help them when they leave or wherever they go with some resources, the more resources you have that are out there, the better of a nurse you will be for that patient.
For sure. So would you say there's anything else to add that will help, other nurses foster the professional growth and development throughout their careers?
Just continue to learn. There's so many changes that happen within nursing that we have to adapt to. There's different paths that you can go. You can become a nurse practitioner, get your master's degree. Education is the best thing that you can have, and so many more opportunities will open up for you.
Definitely. Education is, again, invaluable. That's the best thing you can have under your belt, and no one can ever take that away from you.
Exactly.
For sure. Well, thank you so much for being a part of our Coffee Chat with an Experienced Nurse webinar. Your advice and information was super invaluable to all of us here at Care Hope College, and we thank you so much again and really appreciate you being a part of this.
Well, thank you so much for having me, and good luck to everybody in their career. I hope that you find your passion in nursing and keep going.
Thank you so much again, and we'll definitely talk to you soon.
Okay, thanks so much.
Cheers.